Americans saw significant increases this year in their health insurance deductibles and/or out-of-pocket expenses as businesses tried to keep premiums equal. That means that Americans likely bear a larger burden of our healthcare costs than we did last year. But how much do those medical procedures, exams, and prescriptions cost? Utah is one of the 18 states in the nation with an established all-payer claim database. The idea here is pretty cool. Every bill sent to a healthcare insurer is logged into one massive database, which then researchers can work with to answer all sorts of healthcare questions, like which procedures are being done most often, which medications are given, and when, how much each procedures cost, which hospitals and doctors are most and least expensive, and so on. This is great data to have. The most complete representation of this data is at the state's Open Data website from 2021, posted in one big Excel spreadsheet at the end of 2022. That sheet has over 100,000 rows and is really tough to use. Put simply, different hospitals bill the same procedure differently, making it really difficult to compare apples to apples. The state auditor's office tried to come up with a solution for people to more easily access healthcare data information via healthcost.utah.gov. You can go there, choose one of 177 procedures, and see what it will cost you from various doctors and hospitals. The biggest problem is that the data on the website is now pretty old. Best case, it's from the first half of 2020. Worst case, it's from 2018. As we know, medical costs have exploded in those last 3 to 5 years. Also, if you want something done outside of the limited procedures, you won't find information about it there. In announcing the healthcost.utah.gov, State Auditor John Dougal explained his primary use case for the site: people shopping around for the best price on given medical procedure. But most folks don't get much of a choice where they get their medical procedures done. In emergency situations, hospital proximity probably matters most. In non-emergency situations, people go to where they can get their costs somewhat covered by their insurance. In most plans, most local hospitals are out of network and therefore practically off limits. Dougal also hoped that primary care providers would be able to use the site to smartly refer their patients to doctors or procedures that fit their budget. That doesn't seem to be happening either, though. They seem to be relatively disappointed with the number of people using the website so far. These problems aren't unique to Utah, as states have instituted these massive all-payer claim databases and other items promoting transparency. One of the major goals was to push down the cost of healthcare. The thinking goes that with transparency, hospitals will be susceptible to free market influences of competition and maybe be forced to charge less for their services or risk going under. Like a normal business. That hasn't happened. Unfortunately, the cost of healthcare isn't really a problem that transparency can get us out of. Costs simply usually can't be a factor in the healthcare decision-making process, and so the bills can spiral without much consequence to anyone. That creates a problem for groups like the state auditor's aforementioned healthcare price transparency tool. The state legislature has slated it to end on July 1st, 2024. While this sounds harsh, this seems to be a relatively standard procedure where committees and projects have to show effectiveness to continue receiving funding. So, we want to know your thoughts about healthcare in Utah. Leave a comment below or reach out to us on social media. Thanks so much for watching. I'm Theodora Soder, and this was today's Daily Buzz from the Salt Lake Tribune.